Good day, sir. Are you Mr. Colavecchio?
I'm Dr. Colavecchio to you, sir. Are you my new intern?
I'm sorry, sir. Yes, I am. I'm Mr. Crystal. I'm here to intern you.
Alright. Do you have any field experience from learning from Dr. Street?
Actually, yes, sir, I have. I've done 3 internships at different hospitals around the Montreal area.
Did you help scrub in or you just watched?
I scrubbed in once or twice, but I'm principally washed.
Well, now you're going to help me scrub in. Tell me about your education.
My education. So, high school, that stuff. Then I went to Dawson. I went to the natural science program, and now I'm at McGill in the medicine program.
Alright. A pleasure working with you.
It's going to be a pleasure, sir.
We have a beep. Let's go scrub in.
Help! Help! Someone, please, my arm!
Are you okay, sir? Are you okay?
Thank you.
Go.
Thank you,
Down.
God.
Right here. You know what? This is an easy surgery for an intern. You're going to be doing this surgery.
Sir, what seems to be the problem here?
My arm. I was playing a basketball and then I got hit and I don't know what happened.
Were you losing the game?
Possibly.
So it's a yes.
Doctor, can you just perform surgery, please?
Sir, you can admit when you're losing.
Doctor!
I'm actually not a doctor. I'm actually an intern here.
Why are you doing my surgery? I want the real guy to do it.
Because I'm having practice in my field so I can become a doctor,
Oh, me too. I'm actually studying to be a doctor.
Really?
Yeah.
Well, I must say, the demand for surgeons here in Canada, there's not a lot. The future is not really promising because there are many of us, and it's very hard to crack into the field. And I'm very lucky that I have an opportunity here with Dr. Colavecchio. I'm Mr. Crystal. And what's your name?
I'm Mr. Bargath, hopefully one day Dr. Bargath, but what you're telling me, I shouldn't be a doctor.
You know what? I'm not saying you shouldn't be a doctor because we always love doctors. There's always need for doctors everywhere else in the world. Here in Canada, we have an abundance of surgeons, and for that case, you might want to go to the United States or Europe somewhere, because in Canada we have more than enough.
Okay, and if you don't mind my asking, I was just wondering when I'd be older. I hope you don't take this too personally. Do you know what my possible salary could be as a surgeon?
Alright, well, I'm not really selling the salary right now because I'm just an intern, but you asked Dr. Colavecchio. And, I'm sorry, we're getting off topic. I'm going to start with your surgery here. Dr. Colavecchio.
Yeah, he's a critical surgeon. Let's go.
Can I not have the anesthesia, please? I'd like to be awake and see what you're doing.
Wow, you must be a brave man.
Thank you, doctor. I'm sorry, mister.
It's alright. You can call me doctor soon enough, I'm gracious to have this opportunity. 20 years, I'm 20. Time 22, 23, I gotta be doctoring.
So you could say maybe from 2 to 5 years you could really vary?
Just about, yeah. Thank you, Dr. Colavecchio, for those scissors. Just gonna cut off little part here. Scream if it hurts.
Ah! Why didn't I take the anesthesia?
Do you want the anesthesia or just
No, I want to know more about being a doctor. So, can you tell me what you do on a daily basis as a doctor?
The daily routine, we'd walk in, say hello to our coworkers, receptionist, and then automatically go see a patient. Now, either we're working in the emergency room, or we have actual appointments. So, if we have appointments in our office, or checking on people privately. But, the hospital and the government is really, the government really runs the hospital. And all the doctors here. So, there's some private clinics somewhere, but it's mainly the government. But, you take the job when it's available, especially here.
But,
right.
Do you plan on ever making a private clinic or working in one?
Do I plan? I go with the flow and see what the future holds for me.
So, when do you think you'll be getting your MD, your Doctor of Medicine?
A couple years, maybe, By the time I'm 22, I said before.
If you don't mind asking, how old are you now?
I'm 20.
You're 20? Wow. Dr. Colavecchio, how long have you been doing your job for?
I've been working as a surgeon for 30 years now.
Oh, wow. Because I've heard that once had good field experience for 10 years, that you've been working really hard and you're very good at your job, that you're at the top of your level and you could be making a $100,000 salary. Is that true?
Well, now I'm a chief doctor. I've been working for 30 years as a surgeon, so now I'm the toppest I could be, and I'm making, around $300,000 plus.
Wow.
Yell if it hurts.
That's amazing.
Dr. Crystal, you're doing a great job.
Well, thank you very much, sir, honestly. Mr. Bargath, I must say, I gotta bandage it up, but other than that, you're finished.
Actually?
You're good as new.
Thank you.
Just don't go too hard on those cords. You might lose again.
Sir, that's not nice.
I'm sorry, sir.
I hope you never get your MD.
Why don't I just cut off your limb right now?
Crystal, we treat our patients with respect.
Okay, thank you very much, Dr. Crystal, for
Hey,
this
no problem,
information,
no
sir.
problem.
And I really do hope you get to the doctor. Don't take what I said before. I know it's very difficult. Okay?
Thank you.
But
It's
if you
all
don't
right.
mind, I'd like to finish with asking some questions to Mr. Kalbecchio, because I really want my future to develop nicely.
Dr. Kolbecki, actually.
Oh, I'm sorry, Dr. Kalbecchio. So, hello, Dr. Kalbecchio. I know I asked Mr. Crystal some of these questions before, but since you're more experienced, I really want to ask some of these questions to you. Okay? So, how many years would it take for me? Because right now I'm in Seja. Do you know like how long it's gonna take me?
You have approximately 8 more years if you want to become a full doctor. Maybe just an intern, but maybe 10 to 11 years to be a surgeon.
Wow. Did you get accepted the first time when you applied for medical school, or?
Yeah, I got right into pre-med. Got into internship. Well, I was a very smart. It's very competitive though. Inside CJET, you're gonna see first choice, CJET. There's a whole bunch of people competing. You have to keep your higher score up, and you have to apply to pre-med. Queen's University McGill, get in. Trust me.
Okay, so here in Canada, would you say that McGill is the best when it comes to medicine?
I'm pretty sure McGill is the best. It has the highest reputation. It's definitely the best school for surgery and pre-med.
Okay, and when I'm done with my pre-med and all that, is there a job waiting for me, or am I gonna have to like work my butt off to try to like find a job? And
Truly, in Montreal, there's a surplus of surgeons. It's going to be very difficult for you to find a job. But McGill is very smart like that. They have placements. They will place you in different hospitals to observe the internship. I'm not guaranteeing you get a job, but I will put it in the work for you. It would also be better if you would go to the States, maybe open up a private clinic. I don't know. You should get with a doctor well-known to make.
wow, that's amazing. But are you telling me that it's all about the money?
No, it is not all about the money. Surgery is a very hard job. You have to be dedicated. Sometimes you get calls at 2 in the morning. This is just a daily routine. You get calls at 2 in the morning. You have to go up, get to the hospital on a snowy day. It's very difficult. I love the job.
So you're saying that the environment to work in is difficult?
The environment is very difficult. People are coming, all sorts of people coming. The conditions are very dirty. In a hospital, there's an over amount of people. People have to wait 3 years just to get a brain scan.
Are you saying that this hospital's not clean?
This hospital is not clean.
What?
Yeah.
No, but like, are your medical rooms clean and all that? With your
We try our best, but there's
are
so
your
many.
schools sterile?
Yes,
Okay.
of course.
Oh my god, I'm scared. But I need to know like what medicine or what prescribed pills I need to do this for.
Oh.
Can you please just write me a doctor's note if that's possible? That's possible.
Yeah, sure.
So
We
I can
could give you some codeine for that.
Codeine?
It's the blue stuff. It's very good, actually. Codeine, we'll give you 350 ml of it. Here you go.
Thank you very much.
You're very welcome.
Dr. Kolbecki, been an honor.
Nice working with you.
It's great working with you, sir. Hope I get to do it soon.
What was the most appealing part of being a surgeon for the day, and the least appealing part?
For sure, the least appealing was seeing that weight room over there, you know. People wait hours and hours in the emergency room with the child, or themselves, actually. And people also wait days, months, and even years to get appointments. And it saddens me to the fact that a surgeon is supposed to help them. But when they're in trouble, they gotta wait so long to see us. And I don't like that. You know, the best part is obviously gotta be the fact that I can help people, you know. Because I care, and I'm on this planet for that sole reason to help someone. When I get that smile on my face at the end of the day, when I can tell myself, I've saved a life today. That's the most satisfying moment ever.
Good for you, doctor.
Sir, in the era we're in, what new advancements can we see in surgery?
New advancements is all a technology advancement. Now, instead of surgeons making cuts, it's all going to be precision. It's going to be instruments, robots basically, going into yourself. Precision cuts. That's what the future is.
I can't wait to work with that.
Alright.
I just gotta wait a little longer, though.
I really liked what I saw today, and you know what? I'm going to give you a break. For now, you're going to be my intern, if you want them these. $45,000 a year, starting with, and you could work yourself up to promotions.
Sir, I accept.
Perfect.
What promotions are there in order, you know?
After 2 or 3 years about being my intern, unless I retire, old age, whatever.
Sir, you're not that old, you're young.
No, I'm an old man, it's okay. Anyways, after 2 or 3 years of being my intern, you could eventually become your own surgeon, a pre-junior surgeon, which you could make around $100,000 a year. And it's actually a pretty good deal. So, what do you say?
This is my dream, sir. I'm honored.
Alright.
I accept.
Perfect. Thank you, sir.
I turn the music up, I got my records on, I shut the world outside until